it became pretty evident that Reynolds was not telling the whole story, or at the very least wasn't explaining things well enough.
Yeah.
I want as many Iowans to know what's going on as possible and to understand for their county, but also for the counties around them, what's going on, so they know they can make the right kinds of assessments as to whether or not it's safe to go to the park, or should it be, I should stay home for a few weeks because everyone's getting sick. Those kinds of decisions. I'm originally from Iowa City, third generation Iowa City, and like my grandfather graduated from City High. I moved to Ames. My husband is a researcher at ISU. He's a data scientist. I owned a dog walking business. With my immunodeficiency, having a socially distanced job was very important. I have a very rare immunodeficiency. It's called common variable immune deficiency. Basically, my body doesn't make enough antibodies to notice or effectively fight viruses and bacteria. When news about the pandemic started, like it was just starting in China, my ears kind of went up a little, paying attention to what's going on. And then it started getting on US soil. And I'm like, I need to make preparations just in case it makes it to the center of the country. I was hoping it wouldn't, but it did. And we went into full lockdown on March 7th. We've not had any, I mean, other than like Zoom meeting or seeing my mother from 50 feet away, her in her car, us in our car, we've not seen any other humans since middle of March. Because with my immune system and how easily I get sick, it wasn't really an option. I can actually thank my first husband for teaching me how to use Excel and track different kinds of data and use different types of functions to have Excel automatically sum up or total or do differences or percentages or any of that stuff. This is the nerdiest part of the whole story. I play a video game that is basically a puzzle game for people who like pirates and sailing. I created a very complex tracker. I never in a million years thought I was going to be using Excel to track and analyze pandemic data. I mean, I don't think anybody thought the pandemic was coming. We definitely, like, it wasn't even in the back of my mind. When it first started, I was doing very basic analyses, just looking at the statewide numbers, specifically looking at Johnson County, because that's my home, like my home base, and my mom still lives there, and my aunt and all of her kids. And for me, I was like, okay, I'm just going to look at this, give an idea, look at the logistic curve and the math behind all of this. And it was just like a personal interest. And I actually had all the original, like the early stages over on my political blog. And then it became pretty evident that the pandemic was starting to ramp up for the state. And we were well into exponential growth with my immune deficiency and most of my family living in Iowa City. And since that had the first positives, like the pandemic, the virus itself hit home a lot earlier for me than I think it did for a lot of Iowans.
For people you care about and your personal self.
Exactly. I knew eventually, I mean, with everything that was coming out of the World Health Organization and the CDC, the projections that anywhere from 75 to 85% of the world would eventually contract this virus. Knowing what issues I have, my immune deficiency, my lung disease, I also have a mitochondrial deficiency, like I got a lot of things going on. I knew based on all of the literature, what was coming out, that I would very likely end up in severe disease, if not intubated. I'm a firm believer in not dying. I've been immunodeficient my whole life. Like I've almost died 7 times. Like, I'm not even going to take my chances with this. And I'm a person, I wear an N95 all winter whenever I'm in public, because even with an N95, I will still get bronchitis, pneumonia, sinus infections, all the jazz. I'm not risking it. I don't want to leave my husband, you know, a widower and my son without his mama. So all of my data is sourced directly from the state's website. I do that at 10:30 in the morning and at 10:30 at night every day, so I can get as close to what exactly 12 hours looks like. So it's a full, 24 hours. There's no overlap. That's the data I'm going to use trust. That's the data I trust, because those are numbers. Those are specific individuals that had tests, positives, recoveries, and deaths. When it comes to the breakdowns, so asymptomatic versus symptomatic, or race, ethnicity, biological sex, I don't necessarily trust those graphs because those give only a whole number percentage, and that's a lot of fluctuation. I do scrape that data and I try my best to at least appropriately represent what that looks like. People want to know how many kids got sick. They want to know how many elderly got sick. And we have some of that information in the positive case analysis. We used to have that information for recoveries and deaths, but on July 15th, it disappeared. You can no longer mouse over that graph and get an actual value, which is very, very unfortunate. I wish that we would get that back, but I'm not very optimistic about it. They were originally giving that information for deaths, and I started doing death breakdowns every day of this is how many people died in the last 24 hours. These are the races involved, the biological sex, age group. I could tell even if there was a person who was 41 to 60, I could sometimes give a good idea of what county it was in. And within 7 days, it was gone. Whenever I have the ability to get more data, that's the minute that the state changes the rules. It happened, like I was doing this early on, and we had IDPH regularly doing press releases. Polly Carver Kim was doing them every day. Yeah. I was taking that data and I was aggregating that data, and then voila, Test Iowa occurs, and now there's no data for like 2 weeks. And then we started getting data, and just as I literally spent, it was well over 100 hours constructing the demographics page for my tracker website by pre-existing for each age group so that people could get a good idea of what we were looking at. Within a week, it was done. No longer had access to that information. And Polly Carver Kim doesn't have a job anymore. I don't like being the person that assumes malfeasance. I want to assume that there are idiots in government. I would rather assume there are idiots in government than make the assumption that our legislators are doing things deliberately to hurt us. Except now there's been so many instances of what I would deem ineptitude, but it just keeps happening, that the farther we get into this, the more times that the governor says, think about a mask. Not put a mask on your face, please don't kill your neighbor. Think about a mask. A mask is an option. Or we're going to send our kids back to school. I think to myself, okay, I know what this disease profile looks like through preprints and peer-reviewed research. I know that if you have a member of your family with a high-risk condition, your kid can't go back. Because while, yes, JAMA did come out with an article that indicated that spread between kids was low, it's only true for kids under 10, not over 10. That says nothing about whether or not that kid is going to bring a fomite home and hug their mom, and their mom ends up dead 3 weeks later. The lack of caution that is being displayed by our state government, and definitely by our federal government, it's concerning. Yes, our economy is very important. Maintaining economic production, maintaining families having homes and lives and incomes, all extremely important. But I think the piece that's getting lost is, does it really matter if 3 million Americans die? Won't the economy be completely destroyed if we have 3 million Americans die? And that number is based on 80% of us getting this before we get to a vaccination. It's a risk assessment, really more than anything else. Yes, we know some people are going to die. We do not want that to be a very large number. For Iowa, let's just assume we don't get to a vaccine in a year. People did what they did in Iowa during the quasi-lockdown. We'd get to 100,000 in a year. We're at 40,000 now. We're going to be well over 100,000 by the time we hit a year. Next spring, I would say would probably be 120 to 140,000. That's just based on what Iowans are doing now. Not all Iowans, obviously. There's a percentage that are doing the right thing. They're staying home, keeping their family safe, keeping their community safe, but a good percentage of Iowans are not. And the virus is obviously going to spread unmitigated because that's what's happening. Let's just base it off 2.75% because that's what our current case fatality rate for the state is. If we say 125,000, we assume that 80% is going to become infected, and 2.75, it's about 3,000 Iowans. That's if we assume that the same things will happen that have happened so far. Those values, that value can go up and it can go down. If, for instance, people say, screw it, I'm not wearing a mask, I'm not staying home, I'll do what I want, my kid can go to school, and the virus spreads to the point that it overwhelms all of our hospitals, that 2.75 is going to hike up to 5% real quick. Because the people who needed to get oxygen, not even an intubation, just supplemental oxygen on their face, they won't get oxygen because there won't be a bed for them to get it. This is a problem. The whole reason we, like all of us who've been, doing the data science, also every scientist and researcher and medical professional has been saying we need to flatten the curve. It's not to keep people from getting sick. It's to make sure our hospitals don't get overrun so that we don't have twice as many people dead as we would have had otherwise. This is just based on the data. It's based on the science, what we know about the virus. What we need is for every single American who can work from home to work from home. And all of their children then also need to learn from home. That will enable our schools to do proper social distancing for the few kids who do. They are required because they have a frontline worker parent, healthcare parent, person who works in a grocery store. Those kids then will get the education they need, and they'll need to be wearing masks, social distancing, eating lunch outside, at least, 10 or more feet away from the next person. But if we can depopulate the schools by pulling all of the kids out who can be pulled out reasonably for the duration, that's going to give the other kids a better chance. It's also going to decrease spread because those kids aren't going to be constantly all over each other. Because like my son's class last year had 24 kids were in your class, right, sweetie? And packed into a small room. Social distancing doesn't occur in elementaries, junior highs, or high schools. It doesn't even happen in college. Every single neighbor I have, they have parties, yard parties, keggers every night of the week. It's like, it's a pandemic, so now they want to party. And I keep thinking to myself, guys, I don't want your mom to lose you. Please just go in your house. Our universities should not be opening for on-campus anything. The Board of Regents has made a bad choice. I'm really very clear about that. It's bad. It's very bad. Yes, our college students are younger. That doesn't mean that they're healthy enough to withstand the virus. And we, again, don't know what the long-term effects are here. I know people who have now heart issues after having COVID. I know people who had lung scarring. People who had mild disease still months later feel like garbage. This is not something we want spreading through every single person that comes in contact with it. We want to get to a vaccination, and we need to do that by doing some kind of permanent, for the duration of the pandemic, quasi-lockdown where everyone who can stay home stays home. No people go to grocery stores, no Walmart. Employees who work in Hy-Vee, they go to work, they socially isolate as a group. If you work at Hy-Vee, your friends are at Hy-Vee, you don't see other people. You go to and from work. Same thing for long-term care facilities. If you're a nurse in a long-term care facility, your two social groups are your family at home and anyone who works or is inside as a resident at a facility. Because if we continue having virus going into these long-term care facilities, every single one of the 439 nursing facilities will eventually become a cluster. We keep seeing it, new ones get added. Once the virus passes through, a certain percentage of Iowans in these facilities die, others recover. It's going to be a repeating theme. The helpful thing about having all the data that we have so far now for Iowa is that a number of the counties that were early in the pandemic, Johnson, Potawatomi, Blackhawk, there are now double logistic curves. You can see the first wave and it levels off, and then you can see the second wave. Every few months, we're going to have another wave of virus because a number of people are asymptomatic. They have no idea. They wear masks. They go out. They get somebody sick who then becomes symptomatic, and we start seeing it happen again. Like, I wanted it to be seasonal just like everybody else, and it's obviously not because it's the middle of July and deaths are increasing. Positives are very high every day. We used to have a plateau of 300. Our plateau now is about 500 to 700 on any given day. I shake my head and wonder why it is the state is not working harder at mitigating the problem. And then adding in the fact that the CDC and all of the state and local public healths have decided to decrease the number of days that a person self-isolates from 14 to 10. And they only need 24 hours without symptoms. I know people who had their fever go away for 24 hours and then it came right back. This is dangerous to me. And all I see is the state being very reactive and not proactive. I want everybody to stay home. I mean, on my website, my tagline is, please wear a mask, please social distance. Do it. It's a piece of fabric. We all wear clothes all day long. A piece of fabric over your face does not decrease the amount of oxygen you get. I know I wear an N95 all winter. It's a pain in the neck. Your ears hurt after a while, but that's it. It is showing other Iowans you care about them not dying. You care about their lives, their kids, and that's why you put it on. You don't put it on to save yourself. You put it on to save your neighbor. And we're Iowans. We're taught from itty bitty that we care about our neighbors. We care about our friends, our family, our communities. All of us need to be stepping up and doing that, showing that we care about each other. Because if you don't do that as a person, are you really a human? I don't think so. You need to be caring about other people. Now that I have everything structured and it's just a very simple process of inputting, I spend probably about 3 hours a day inputting and updating graphs, all the tables that I have. And then I probably spend about 6 or 7 hours a day answering questions from everyday Iowans who want to know exactly. They want to know what their risk is. I have this high risk condition. My kid has this thing. We just went to the doctor. How do we approach this here? A lot of my day is spent helping other people feel safe. I have a Patreon. It's my first, middle, and last name, Sara Willette. It's wonderful that people want to help. And I greatly appreciate all of the help and support because, I mean, the website does cost money to maintain. It's not a lot, but it's a little bit. And I know that for others, helping support the work that I can do, it plays back and forth because I help them stay safe. They make sure it continues. And I also don't want anyone who's like financially strapped. I tell people, if you are financially strapped, do not send me money. Do what you need to do to stay safe. Doesn't matter if someone's totally healthy. They're still dying that are totally healthy, no underlying conditions. I don't want that. I don't want anyone to lose a parent, to lose a child, to lose their best friend. If at the end of this, I can say I saved some lives, I will be very, very happy with what I've done.